Welcome to another episode of Holistic Health Habits, the podcast where we explore innovative approaches to holistic health and wellness. I'm your host, Surani Fernando, and today we're deviating a little from our traditional nutrition-related conversations and talking about something that has often been discussed by experts as equally important when it comes to nourishing the body: sleep. Today we have with us Dr. Damon Ashworth, a renowned clinical psychologist and author of Deliberately Better Sleep. With a doctorate in clinical psychology from Monash University and extensive experience in treating insomnia and depression, Dr. Ashworth is here to share his insights on sleep and mental health, and we're looking forward to the conversation. Welcome to the show, Dr. Ashworth.
Thank you very much. Glad to be here.
Great. So before we start, can you just tell us a little bit about your background as a psychologist, your training, and what drove you to focus on the phenomenon of sleep when it comes to improving health outcomes?
Yeah, definitely. I studied my clinical psychology doctorate at Monash, and my research was in sleep. So I did a clinical trial where we treated people 4 sessions across 8 weeks, and people that had insomnia and depression, and they'd taken antidepressants, but they hadn't gotten better. And so we thought if we target the sleep and try to improve that, then it could make a positive difference, not just on their sleep and insomnia, but also their depression. So that really got me into it. And then I started working at the Melbourne Sleep Disorder Centre after that.
Okay, great. And just talking a little bit about insomnia and depression, can you just give us a background on what exactly the problem, what the problem is, how widespread it is, may possibly quite undiagnosed, especially on the insomnia front? Well, I guess both. Yeah.
Yeah, definitely. So I'd say depression, it's one of the most leading causes of disability worldwide. So it does impact a lot of people. I'd say numbers vary between maybe 6% for depression that people will suffer, but in their lifetime, it can be as high as 30%. Now, in terms of insomnia, it is about people that really struggle to fall asleep or stay asleep during the night, and then they feel not as refreshed as they want to be during the day. And that can impact, again, about a third of people on any given night. And for the severe range where people have that diagnosis and they really need to seek help, it's probably about 10 to 15%.
Okay. And what's the current way of treating that? Like the traditional way, you mentioned antidepressants. Obviously, there's going to be interventional drugs. What are the different options that are popular?
Yeah. In terms of seeing a psychologist, obviously people with depression, they do get a referral through a mental health care plan in Australia. So they'll come and see us. And often the research shows that a combination of taking medication, so antidepressants, as well as therapy, is more effective than just taking one by itself. And then in terms of insomnia, it used to be that people would get sleeping pills a lot from their GP. But now people are starting to realize more and more the importance of talking to someone who's a sleep specialist and getting some tailored interventions for them.
Okay. And so you've conducted a lot of research on cognitive behavioral therapy for insomnia. Can you share how CBT-I has evolved over the years and its impact in treating insomnia and depression and, some of the, most significant findings that you've found in your research?
Yeah, definitely. I'd say back to the 1960s or 70s, they were looking at some individual interventions for insomnia. So little things that people could try, or tips or tricks. And what they realized is some of those work really well for some people and then not at all for other people. So CBT-I really combines a lot of these interventions that have a lot of evidence behind them as being helpful. And by putting them all together, hopefully you can throw as wide a net as possible and make the biggest impact for as many people as possible. Yeah, so the one that I went to was a 4-session intervention, and it looks at educating people around sleep, looking at their behaviors and making sure that they're doing things that are going to be helpful, looking at their beliefs around sleep and trying to challenge that. And then finally, it's about self-management. What can they do to keep those improvements going over time?
Okay. And what's your opinion on, with that self-management, like the different sort of tools that are out there that people might be using to track their sleep, or, as people have the Aura ring and things like that? Is that something that you recommend, or, do you promote that, or does that sort of counteract some of the work that you would do with your patients?
I think it definitely has its purpose. I have both a Fitbit and an Aura ring.
Okay. That's good to know.
I track my sleep a lot, and I think it can give us some really valuable information. With certain people, it can lead to a fair bit of health anxiety. And
Okay.
if that's the case, then it's probably recommended to not look too much at that. But sometimes there can be sleep state misperception as well. Whereas people might think they're only sleeping 2 or 3 hours a night, and then you use a sleep tracker and it shows that they're getting 6 hours. And so that can be
Okay.
helpful at reducing that. It leads to
Yeah.
more anxiety. I'd say stay away from it. But if it's
Yeah.
helpful, then seek it out and try to keep using
Okay. And you have your book, Deliberately Better Sleep, which combines your research and clinical experience. What inspired you to write this book, and how does that integrate with your clinical practices?
it. Yeah. I think in the sleep field, there's a lot of people talking about what people should do. And I'm not sure if everyone fully understands the why behind it. And so deliberately better sleep is really teaching people the method to figure out what's going to work for them, to then be able to apply that and test that out, and then to see if they can keep kind of putting that into their self. So again, I was saying that some interventions will work for some people and not for others. I think it's really important to figure out for people what works for them, and then
Okay, and this book is for just the general population. It's not for professional, like helping professionals with their patients.
no, definitely. I think
No.
professionals could read it from it, but it's really just walking an individual through what's going on with their sleep, helping them to understand it, and then looking at what are the things that have the most evidence behind them they could try, put it into practice, and then be able to see how it's going and then keep.
And what are some common things that people do in their everyday lives that are directly connected with, poor sleep that you would say, has been the biggest breakthrough with your findings and what's in your book?
Yeah. What's interesting is I think a lot of people do what's called social jet lag, in that on weekends they'll sleep a lot later in terms of going to bed later and also waking up a lot later than what they
Yeah.
do during the week. And then let's say they sleep until 11 a.m. on the Sunday, and then they try to go to bed at 10 p.m. on the Sunday night, they're not going to be able to sleep. So I think regularity is one of those things that I've really noticed that if people don't have that, it's going to start to have a negative impact on people's sleep.
Okay. So just like having that routine, what does that mean for people who have to work things like shifts and have to have like a different sort of routine?
Yeah, shift work is very hard for that reason. So I think it was
Mm.
Matthew Walker. He talked about QRT, about four things that are important for sleep. The first one's about
Mhm.
quantity, and that most people would want to get somewhere between 6 to 8 hours of sleep if possible.
Yeah.
The next is about quality. So are there certain things that you're doing that are reducing that quality, that are stressing you out, and can we lower that? The next one is about regularity. So again, the more consistency we have from night to night and across the week, the better our sleep's going to be over time. And the last one is about timing. So let's say someone's a early bird, they're probably going to sleep best between maybe 9 p.m. and 5 a.m. And so for them, sleeping outside of that time won't be good. And if they're a night owl, then they might sleep best between 1 a.m. and 9 a.m. And if they go to bed too early.
Right. Okay. So it really depends on like who the person is and like how the individual rhythm is. Because I get a little bit conflicted with this. I think I'm definitely a night owl, and I find myself, it's difficult to go to sleep when I'm supposed to, but then I have no problem sleeping in the daytime, like taking a nap or something like that. Especially on weekends, yeah, it's completely fine for me to have, what I feel is stimulation from the outside, and there's light and everything, and it's fine. But people do also say that we should be, our rhythm should be according to the sun, with when you should be getting ready for bed, when you should stop eating. Everything happens around the sun. What's your opinion about that, with just the sun being the constant, and then with other people that might have different internal rhythms?
Yeah, well, our internal rhythms, they have an impact on our circadian rhythms. Circadian is Latin
Yeah.
for about a day. So every person does have about a 24-hour cycle, but some people will have an advanced cycle, going to be better for them to eat, to go to bed earlier, to wake up earlier. And some people have more delayed one where they will want to eat a bit later, go to bed later, get up later. And so I really think it's about figuring out what that style is for each person. There are some good
Yeah.
questionnaires out there. One's called a morningness, eveningness questionnaire, and that can really help people determine a little bit what their body clock might be. And then if we
Okay.
can sleep at that ideal body time, regardless of what the sun is doing.
So what was that question, and where can people find that if they want to dig into
uh,
that?
yeah, it's called the morningness, eveningness questionnaire. So you could just type it into
And one other thing that I was thinking about is something that I've definitely noticed when I have done it, but it's very difficult for me to do, is to, stop screen time a few hours before bed. It's, yeah, the times that I have done that, it's just because, there's been a reason to not look at my phone before. But, you know, usually every day there's some reason to look at my phone, check a message or check or finish up things before I go to bed. Is that something that's been proven with poor sleep, disrupted sleep?
Absolutely. Yeah. I do think people are just using their smartphones so much more over the last few years. And I think
Yeah.
that has coincided with sleep problems getting worse, with people sleeping later, waking up more during the night, feeling more unrefreshed the next day. Yeah. So if we
Yeah.
can have a bit of a break before sleep, it's going to be really useful. But I think there are other reasons why the smartphone can be problematic. And that's because it triggers a little bit of dopamine in our brain every time we get a notification. Our brain then so there's other reasons why we want to stay off the phone apart from just.
Okay. And how does that compare with reading then? And like reading a book, and also reading on a like a Kindle or something like that.
Yeah, Kindle isn't too bad. I'd say reading in the
Okay.
but reading a physical book is probably, for some people that can be harder for them to sleep. But for most people, I'd say it'd help them to wind down and relax before bed. And then once they're feeling sleepy, they can put the book down and it's easier to get.
Okay. And, you've worked with various psychological frameworks, including CBT, ACT, and positive psychology. Can you talk a little bit about each of those, expand on them, and how do you determine which approach to use with a client? And maybe if you can share sort of a success story where, you've integrated these different frameworks and it's led to a significant improvement.
Yeah, definitely. If we were to briefly look, CBT just stands for cognitive therapy. So it's looking at all of our beliefs about things and all of our behaviors. So it can be quite broad, but at its basic level, I think it's looking at what we can change. Whereas acceptance and commitment therapy is much more starting with the focus of what are things that you've always been trying to change for whatever reason you can't. And would it be better if we start with accepting and saying, okay, now let's look at what's most important to me and try to put some goals in line with that. And then positive psychology is much less looking at the negative aspects of life and looking more at our strengths and how we can put them into practice. So I do think it's useful to apply each of those. So I use the VIA character strength survey with people, and it helps clarify what their key strengths are, and then they can apply that in their life. And then you're still using CBT principles to say, what are some things that we can do to change these things? Or what are some beliefs that hold you back? We're still looking at ACT in terms of values and what's most important, what goals we can set.
Okay. And do you have like a success story that you can share?
I probably couldn't say too much about it due to confidentiality reasons.
Without naming anyone. Yeah. I mean, anything general, like, or maybe trends or something like that you've seen.
Yeah, definitely. I know at the Melbourne Sleep Disorder Centre, I was there for about 6 years, and I saw lots of people that came in with insomnia and sleep problems that they'd had for 10, 20, sleeping pills all the time. And by the end of a 4-session program over 8 weeks, they were able to get to a point where they were feeling so much more confident with what they were doing. They were still having times where they were waking up, but they weren't as distressed and they were just feeling a lot.
Okay. And, you mentioned the sleeping pills. Obviously, there are prescription pills that people are taking, but there's a lot of other things, supplements and things like that are, are supposed to help you with your sleep. Not sure, what the evidence is. What's your opinion on some of those things? I mean, obviously the melatonin is the big one. And then there are some other things out there. Do you want to talk a little bit about what you're seeing being used, even if you don't, agree with them being used?
Yeah, definitely. In terms of benzodiazepines, such as Valium or temazepam, they're not recommended for more than, say, 2 to 4 weeks at a time. So if people are taking those, it's maybe good as a stopgap or a little short-term solution. But I think things like melatonin can be better to use on a more regular basis because that can help set our body clock. It can help bring it forward. It can help us to get more regular sleep. So I do think melatonin has its purpose, especially if people have a delayed body clock. In terms of magnesium, I've heard that can be really good if people have muscles that move around a lot, they're feeling a bit restless. That can help to settle the legs down a bit. I think if people have enough magnesium in their system, it might not do heaps, but for people where they've got a bit of a deficit, it can make a big difference.
Okay.
And outside of that, people take valerian and chamomile tea and things. And if it helps
Yeah.
them to sleep better, then it's really good. But I don't think it's going to be the magic bullet for everybody.
Okay. You did mention magnesium. I know that there are a couple of types of magnesium that, do different things. One maybe for sleep, one more like a laxative. Is there a particular type that is for the sleep?
There might be. I would probably speak to
Okay.
nutritionists.
Yeah.
About it.
Yeah. Okay. Well, we didn't talk about emerging trends, but we did talk a little bit about the technology, like the Aura Ring and things like sleep trackers. But what are you seeing in terms of emerging technologies that you're using, as a practitioner in your space, and how that's impacted the treatment of insomnia and depression? And what do you see emerging in possibly the next decade as a practitioner, what you might use, in your practice, but also for individuals to use?
Yeah, I'll be really interested to see how AI is integrated. I was talking to another psychologist, and they were saying that you could have a AI software that listens in on sessions with people, and based on that, it can then tell you what type of personality structure the person has and what interventions are likely to be most helpful for them. So I think AI, as long as there's consent, could have some really positive impacts in helping the clinician to go.
Okay.
In terms of technology at home, there's a few different things where they try to cool down the temperature of the mattress and things like that. And that's actually showing some really promising findings. So if we can change temperature, if we can change the environment, these things can make a big difference over time. So I'm excited to see what.
Okay. And, I didn't really think, I just thought about this now. Is what you wear to bed important? The materials. Obviously, people say it's better to sleep with nothing on, like, you can help your body breathe. I don't know if that affects your sleep quality. Have you done any research on that? Anecdotal research?
I haven't done any research on it, but it does make sense. I know with temperature, 16 to 21 degrees Celsius is ideal. So if people are too cold, wearing some things that can help warm up the body a little bit would be nice. I'd say comfort is important. So for some people, sleeping naked might help them to feel really comfortable. I'm not sure I think on some level it would make me feel a bit more anxious. And so that wouldn't be good for my sleep. So whatever people feel comfortable in, whatever they feel the right temperature in is probably going to make.
Okay. And you recently completed volunteering as a mental health specialist in Vanuatu, which sounds really interesting. How did that experience shape your perspective on global mental health issues, and what lessons did you bring back to your practice in Australia? Are you based in Australia, or are you based somewhere? I think I saw South Banks. Okay. Melbourne, okay. Yeah, what did you learn from that?
Well, I went over in 2018, so I did nearly 3 years altogether. And in Melbourne, or in Australia, there's over 30,000 psychologists, whereas in Vanuatu, there was no other psychologists. So I was working with a really small team. I think we had 4 mental health nurses, 1 psychiatrist, and we were trying to get across the 83 islands and help out people and train up nurses. So it was an amazing experience. I didn't see any depression. And so I think potentially there's more work that needs to be done in building awareness. But it also might be that there's some real benefits in the community atmosphere that they have there and how much people are connected to each other and supporting each other. So I'd love to see more work on our social networks in Australia and the benefits that can have to our mental health.
Yeah, and it's interesting just going into different societies. I'm actually also from Australia. I'm from Sydney, but I live in Madrid. And it's just the difference in culture of, the timings of how people do things, when they have lunch, when they have dinner, when they go to bed. Even children and their sleep patterns are very different to what we would, experience growing up in Australia. And I'm always curious about that. Like, from a sleep expert, how do you decide what's right and wrong, and like what other elements impact how you would assess a child's or even like a person's overall sleep? And I'll give you an example. So, I have nieces that are in Australia, and their bedtime, they're 9 and 11, and their bedtime is, something like 7:30, 8:30, around that time. But that's like here with the same age group, the kids would have dinner at 9:30 and then they would go to bed a lot later. And then people always ask me, but like, do they get enough sleep as a child? And, when do they wake up? And they still go to school around the same time. So I'm curious to know what your thoughts are on that with different cultural practices and affecting sleep.
Yeah, I definitely think it would. I know in Vanuatu, a lot of the children went to school at about 7:15. And I do
Yeah.
think that would be too early. I think that would be eating into how much sleep people are getting. And that could have some negative impacts on their mental and physical health. So we
Yeah.
know that children need more sleep than adults. And so if we can get school times to start a bit later, then they'll be able to get the sleep opportunity, especially if they're staying up. What's
Yeah.
interesting is with any recommendation, it needs to fit in with the person and with their family and with their culture. So
Yeah.
if somebody is eating dinner at 9:15 and you're telling them to go to bed at 9, obviously it's not going to work. So it needs
Yeah.
to be what's going to.
Yeah. And I think that, like, just with my observations, there's a lot of practices that in other societies people might say, but that's not healthy. It's not healthy to eat so late, and it's not healthy to go to bed at this time and whatever. But then when you look at general mental health rates or general, life expectancy and things like that, you are seeing you are seeing health, as a result of doing certain things that might not be healthy. And I think, as a mental health expert, it's really a big part of it, which is like taking care of, your social circles and really, nourishing that part of your life will help you in other aspects. But yeah, I guess it's pretty difficult to pinpoint, what is the best way.
Yeah, I don't think there is a best way. I think it really does need to be for that person, what's going to work for them, what's going to fit in with their family, with everything. I was even
Yeah.
talking to a client the other day, and we're talking about what an ideal bedtime for them might be. But then they live with their partner, and their partner goes to bed an hour earlier. And so for
Yeah.
them, they might actually want to push their body clock forward and to go to bed at the same time as their partner, even though it might be ideal for them to sleep an hour later from purely a sleep perspective.
Yeah, yeah, for sure. So basically, it really has to be, and that's where someone like you would come in when you have a patient that's really suffering. You look at every aspect of their life and try and, mold it in a way that is going to fit in with their whatever their lifestyle is and whatever their family life is.
Yeah, and it would be similar with food as well. There might be a certain diet that works really well for one person, and then it's just going to be the worst recommendation for another person as well. So we need to say, all right, these are the options. I think these could be good, but out of those, what do you think is going to work best for your lifestyle? What do you think you're going to stick at, and what's going to make the biggest difference over time?
Yeah, definitely. And what would you say are some like really negative things that are emerging? We talked about technology and we talked about, possible AI coming in. As we go into this new phase of technology, what do you think we have to really be careful of and cognizant of to, protect ourselves?
I do have concerns about definitely smart, just in terms of I'd say for a lot of people these days, they're using it 4 or 5 hours a day. And that can't, it's going to eat social connections with other people. It will lead into exercise and sleep and things like that. And so
Yeah.
I think we need to start looking at how we're using these things and how we'd like, and then coming up with different tips and tricks to make it easier to do the things that we want to. So there will be times where I will put my phone as soon as I get home in the kitchen, attached to the power, and then I can't just pull it out of my pocket. But if it's right there, I'm
Yeah.
probably going to look at it more than I want to. So there are a few things where we need to start doing things to make it harder to do those things that feel easy, but are not going to be good for us in the long
And I'm sort of curious as to how your practice and how your research impacts your life, and what sort of things do you adopt that, as your research progresses and you adopt certain practices into your own lifestyle? Like, what does a day what does the day look like for you when it comes to those things?
Yeah. I mean, I work mostly in private practice these days, so I don't do too much sleep research outside of individual experiments and helping other people. Uh,
Yeah.
in terms of how it works for me, I use activity trackers. So I do look at my sleep and my readiness scores and my stress levels, and I do what I can to adapt and to manage. I do recommend for most people to go and talk to someone if they can. If it's a psychologist, if you can afford that, that's going to be. So there's lots of different things we can do, and I've integrated. So probably journaling, meditation, and definitely going and talking to someone.
Okay. And, we have a lot of listeners that would be maybe health professionals, holistic health professionals, focused on things like more lifestyle, nutrition, physical activity. Also, sleep comes into that. So, but for those new to, cognitive behavioral therapy for insomnia, what foundational knowledge or skills should they focus on to effectively help their clients when it comes to the broader holistic health approach?
Yeah. So in terms of cognitive behavioral therapy for insomnia, I'd say the two interventions that have the biggest benefits can be stimulus control or sleep restriction. So stimulus control, only using the sleep and sex, only going to bed when you feel sleepy. If you can't fall asleep within about 15 to 20 minutes, you're meant to get up, go to another room, wait till you feel sleepy again and go back, and then to get up at the same time 7 days a week. So that's got a lot of evidence behind it. The other one is sleep restriction. And that's saying how much time would the person like to be sleeping each day? And let's say they'd like to be getting 7 hours. Then the key is to actually reduce the amount of time that you're in bed for to just a little bit more than that. So if someone's not sleeping well, they might try to be in bed for 10 hours a night, but that's just meaning that in themselves. So what happens if they cut that down to 7.5 hours in bed? They might not sleep any less, but they might spend a lot less time in bed awake, and then they're less frustrated. So I'd start with those two if they want to start.
Okay. And is it that range of 7 to 9 hours is the sweet spot of sleep?
That would be what most people would recommend. I do think there are some short sleepers out there where they can get by on a bit less. So it is about finding out what's the right amount for each person to feel refreshed and to function well. But I'd say the average person probably would be best if they're sleeping somewhere between 7 to 8 hours.
Okay. And what happens if you oversleep? Like if you get too much sleep, are there connections with any particular negative impacts?
I think so. I'm not sure if it's a correlation or a causation. If you look at a lot of the longitudinal studies where they'll track people for 6 or 7 years, people that are sleeping 9 or 10 hours a night on average actually have worse health outcomes than people that are only sleeping 7. So I do think there is such a thing as too much sleep. Maybe it's already that they're sick and that's why they need more. But I don't think it's about to get as much, but getting the right amount.
Getting the right amount. And another one that I've always been curious about is that if you have, if you're that person that needs 8, I would say that I need 8 hours of sleep. I can function on 7. Anything less than, I'm not, I don't function. But sometimes I wonder if it's the average, daily sleep that you need. And if some days, you're getting like less, 7, 7, 7, and then on the weekend you sleep 10. Is that, you mentioned routine is important. So does that like throw everything out?
It can
equilibrium out?
Yeah, especially if people are sleeping too late, it is going to make it harder going forward.
So
I would say it's best to not try to catch up on lost sleep too much, but to get back into a good. Yeah.
So even on the weekends, sleep-ins are not recommended.
I would say that, and that probably doesn't make that. I do think it's best, if you do sleep in max an hour late. No more probably shouldn't be too much of a problem, but I definitely wouldn't be trying to spend 3 or 4 hours more.
Okay. And then things like what you're eating impacting sleep, what you should avoid before you go to sleep, or maybe, I'm not sure if you would in this context, you would pay attention to the things that you should do when you wake up. But are there things that you have found to be helpful in that sense before sleep?
Helpful? Yes. In terms of harmful, probably the two things I've noticed that have the biggest negative impact is if we eat too heavy a meal too close to bedtime, that's not great.
Right.
And if we drink alcohol before bed. So I'm not sure if people understand how negative an impact it can have.
Right. And is that drinking alcohol, a couple of hours before bedtime, or just drinking it at all? It negatively impacts your sleep?
Yeah, it will impact it. So if you have one drink, say 4 hours before bed, it probably won't impact it too much. But if you're having 3 or 4 drinks, expect that you probably will have a bit of a worse sleep in terms of quality and quantity.
I mean, I think everyone might have everyone who drinks would have an experience of that. I think experience of having bad sleep, or even, trying to fall asleep. What about caffeine? Because that's something that is a bit debated, People will just be like, I'm not drinking any coffee. I won't be able to sleep if I have a coffee after 3 p.m. But then you have other cultures that are having a little espresso after dinner. And so I've never understood the caffeine thing with that. And personally, I am fine to have a coffee after dinner, but sometimes I do that and then have a horrible sleep. I can't go to bed. So yeah.
Yeah. We know that caffeine, if we're already feeling a little bit stressed about things, it's probably best to not be having caffeine and not having it too late. So generally I'll say, if you're going to have, it's not a problem, but I'd probably try to stop by 2 p.m. if you can. That'll give you enough time, get back to a baseline. But if people are having it right before bed, if they're really sensitive to it, I would never recommend it. Some people will sleep okay, but if you look at their sleep architecture, it will show that.
Okay. All right, great. Really great tips. And finally, just, as we have these health professionals listening, what advice would you give them for them to ensure that they stay updated with latest research and advancements in the area of sleep, also when it comes to advancing holistic health for their clients?
It's an interesting thought. I obviously go to conferences and things like that. So if you can go to conferences where they do talk about sleep, it might be hard for people to do that. So I do try to keep up to date with the journal articles and with the latest books. On my website, I will post a few things. So there are different ways to keep up. But I'd probably say the best thing to do is to get in touch with a sleep physician if you wanted to and ask them a question and say what's going on there. And then they might be able to put you in the...
Okay. And, you obviously have free resources on your website. Are you available, are you on social media or anything like that for people to follow you?
Yeah, I do have Twitter and LinkedIn. I've stopped using Facebook and Instagram again because I'm worried about how much time that can take up.
Right. Yeah. Okay, so they can follow you there. And are there any, influencers, sleep influencers or, experts out there that you recommend also for people to tap into that can share some good insights on this?
Yeah, Dr. Matthew Walker is doing a lot in raising awareness of sleep issues. I think sometimes he can make people a bit anxious as well. So if it does lead to you feeling anxious, maybe I wouldn't recommend him too much, but he did a 6-part series with Andrew Huberman, which went into heaps. So that'll probably give you more detail than most people ever need.
Right. Definitely a fan of Andrew Huberman. So I'll check that. I'm going to check that out as well.
Yeah.
Okay, great. Well, do you have anything else to add? Are there any last words before we close off? Anything I missed?
I guess I would just say that if people want to get a copy of my book, it is out there. So if you go to Amazon, you'll be able to get a copy of Deliberately Better Sleep. And hopefully it will teach you all the skills that you need to be able to become a good lifelong sleeper.
Okay, perfect. Well, thank you so much, Dr. Ashworth, for sharing your valuable insights with us today. Your work in the field of sleep and mental health is truly interesting and inspiring. And I encourage listeners who want to learn more to check out Dr. Ashworth's book, Deliberately Better Sleep, and visit his website at damonashworthpsychology.com. Thanks to everyone for tuning into this episode for Holistic Health Habits. If you like this episode, don't forget to subscribe, rate, and review our podcast so that it can reach more people. Stay tuned for more insights into holistic health and wellness. And until next time, I'm Surani Fernando. Take care and stay healthy.